Did you know that very little attention is paid to oral cancer, and yet almost 3,100 Canadians this year will develop some form of oral cancer? It's mainly a disease of the 40-plus age group, and men are more at risk than women. And the prognosis for oral cancer is very much dependent on the size. If the size of the lesion is 4 centimeters or less, and the lymph nodes are not involved, the prognosis is almost as high as 90%. But if the lesion is greater than 4 centimeters and the lymph nodes are involved, the prognosis of survival drops down to almost 32%. So early detection and the size of the lymph nodes, as well as lymphadenopathy, is critical. The most common type of oral cancer found in the mouth is squamous cell carcinoma. And squamous cell carcinoma is found on the tongue, and sometimes it's found in the buccal vestibule, the cheek, and the roof of the mouth. The most common type of skin cancer is basal cell carcinoma, and it's mostly found on the face, but in particular the nose and the lower lip. Well, you may ask, what are the causes of oral cancer? The most common causes of oral cancer is tobacco, chewing, as well as smoking tobacco. The second cause of it is excessive alcohol. The third is the human papillomavirus, which is the same virus that causes cervical cancer. And the last cause is the sun affecting the lower lip, especially the UV rays. You may ask, what are the signs and symptoms of oral cancer? The signs and symptoms are persistent pain, sores that don't heal or take a long time to heal, slurred speech, difficulty swallowing, bleeding mouth, bleeding gums, and lymphadenopathy or swollen lymph nodes. The detection has been the same for a long time with oral cancer. It's mostly visual and touch and feel. The lesions usually appear as a reddish raised lesion with a white border and sometimes may be ulcerated. But now there's an adjunct to helping in early detection of oral cancer. And one of the newest products that has come out is called Velscope. Velscope uses blue wave light spectrum, which causes intraoral tissue to fluoresce. So healthy tissue looks green in color, while as abnormal tissue looks dark or black in color. There is also the oral CDX brush test, where you scrape the lesion with a brush, put it on a slide, and have it looked under a microscope. Now coming back to the Velscope, this is the Velscope VX diagnosis equipment. And basically what you do is turn it on and look into the intraoral tissue about 2 to 3 inches away, and it'll cause the intraoral tissue to fluoresce. As I said, the intraoral tissue gets excited and it appears green in color. Normal, healthy tissue appears green in color, while as abnormal tissue appears dark or black. Now, the beauty of this piece of equipment is that it will pick up dysplastic cells, precancerous cells, and cancerous cells. So early detection, greater rate of survival, greater prognosis. Once you use this test, and if you see something that is abnormal, there's a camera that comes attached to it. You would take a photograph of it, download it into the computer, and then send that image to the specialist for perhaps a biopsy, because remember, the specialist doesn't have this piece of equipment, so he can't see what I see. And this way, he'll have a very good idea of what I'm talking about. So once again, I recommend this once a year to our patients, just like a woman would go for a pap smear, men go for a PSA test or a prostate test. We recommend this to our patients once a year. Having said that, because of the way sexuality is heading, a lot of teenagers are developing oral cancer simply because of the HPV virus. So I'm also recommending it to anybody that's somewhere around 16 or 18 age group and above, not just the 40-plus age group. So Visiting your dentist every 6 months is not just to get your teeth checked or have your teeth cleaned. There's a lot more that a dentist can do for you. And in our office, we have diagnosed in the last 5 years 11 cases of oral cancer. I have diagnosed diabetes, osteoporosis, and even AIDS I have diagnosed from the mouth. So visit your dentist regularly, and dentists are more than just fixing your teeth and cleaning your teeth. And I hope this piece of information helps you in your oral health. Thank you.